The rise in new COVID cases has largely been attributed to the spread of the Delta variant. Brittany Klein-Peter looking into that and a recent rise in hospital wait times as well. Brittany?
To put some of this in perspective, we just saw over 2,000 new cases over the weekend. A month ago, we were only seeing a few hundred new cases over a 3-day span. An Atlanta doctor told me today that she's seeing longer wait times at ERs across the metro Atlanta area, and she's worried that history could repeat itself.
We've seen this movie before, and I'm very concerned that we're going to see similar surges. Even though we were seeing the light at the end of the tunnel for the pandemic and we saw the hospitalizations had previously been down, now they're going back up.
Atlanta Dr. Frida Fisher, who specializes in the treatment of diseases of the kidney, says she's been struggling to admit her patients to area ERs since last week.
Hospitals that we really depend on, Grady, they're actually at 105% capacity, meaning that some of their emergency department beds are being used for regular hospital stays.
According to the Georgia Coordinating Center's database, at last check, 15 local hospitals are considered overcrowded or severely overcrowded, with 6 experiencing ICU or ER diversion. That means they're not accepting patients via ambulances to those departments. Today, the State Department of Public Health reported just over 1,200 new cases of COVID-19 across Georgia. The rate of new cases gradually increasing over the last month. Just yesterday, the state finally hit a vaccine milestone of 40% of eligible Georgians now fully vaccinated. However, that still leaves more than half of the eligible population unvaccinated. According to DPH, only 94 people who have been vaccinated have died or been hospitalized due to COVID-19. For perspective, that's out of the over 4 million fully vaccinated Georgians. This group of breakthrough cases only represented 0.002% of that population. And while some people are still hesitant to get the vaccine, the CDC recommends only individuals who are allergic to an active ingredient in the vaccine to not get it. As far as the population who suffers from autoimmune diseases, Dr. Fisher says the benefits far outweigh the risks.
A small, exceedingly rare population that would not need vaccination. But because people with lupus and other autoimmune diseases are immune compromised, that means that they are at a high risk of getting COVID-19, the disease.
According to the CDC, the Delta variant is now responsible for 83% of all new U.S. cases. Last week, the CDC director said it only attributed to about 50%, demonstrating just how quickly this strain is really spreading.